Hi guys, so now we will discuss about this question that you can see in your screen, which asks which of the following condition that affects primarily the metaphysis, right? So option A is your osteomyelitis, option B osteosarcoma, option C giant cell tumor, and option D osteoclastoma, right? So out of these four options, they are asking which affects your metaphysis, right? So we will see all the conditions affecting different parts of the bones, right? So let's go to a diagram. Yes, so if you just focus on the slide, so we can divide bone in three parts. Like if I say this is your epiphysis, right? 1 second. Yes, so if I say this is your epiphysis, which is the end of the long bone, right? End of the long bone is your epiphysis, correct? And this is your diaphysis part. Diaphysis is the shaft of the long bone, right? So in between epiphysis and diaphysis is your metaphysis, correct? So this diagram shows you different tumors or different conditions that occurs in different parts of the bones. So if I start with diaphysis, so you can see that in diaphysis you can see conditions like adamantinoma, osteofibrous dysplasia, round cell tumors, Langerhans cell osteocytosis, fibrous dysplasia, right? Then osteoma, stress fracture, chronic osteomyelitis. So all these conditions are found in your diaphysis usually, right? Talking about your metaphysis, you can find fibrous cortical defect, non-ossifying fibroma, osteochondroma, osteosarcoma, right? Then fibrosarcoma, aneurysmal bone cyst, simple bone cyst, fibrous dysplasia, osteomyelitis pyogenic. So you can see that osteomyelitis can be seen in metaphysis, unlike chronic osteomyelitis which may be seen in your diaphysis, right? And in epiphysis you can see giant cell tumor, osteomyelitis of fungal and tuberculosis, right? Then aneurysmal bone cyst, articular osteochondroma, also known as Trevor disease, very important. So all these conditions we can find in epiphysis, also chondroblastoma in children. Okay, so remember the conditions location wise. So even if your x-ray is provided or any clinical scenario is provided, you can guess the tumors that if you can remember the tumors with their locations, it will be easier to get to an answer, right? So coming back to the question that has been asked, like which of the following condition affects your metaphysis. So we just now saw that your osteomyelitis occurs in your metaphysis, osteosarcoma also occurs in your metaphysis. Both GCT and osteoclastoma are same only, right? So they occur in your epiphysis, right? That is the end of the long bone, right? And these two occurs in your metaphysis. Can we see the diagram again, right? So see, osteomyelitis occurs in your metaphysis plus osteosarcoma also occurs in your metaphysis, right? So if I talk about this question, I will say option A and option B, osteomyelitis and osteosarcoma, they occur in your metaphysis region, right? Now I will also discuss here some important bones where you will find these tumors usually, right? So let us discuss in this slide only. So if I talk about osteosarcoma, right? So osteosarcoma can affect any bone, but most commonly involves the long bone metaphysis, as I already discussed in this question. But the bones that are usually involved are usually knee joint and the proximal end of humerus, right? Proximal humerus I'm writing. So these two are the locations where you can find osteosarcoma most commonly, right? Most common bones that are affected, right? And most common region of the bone affected is your metaphysis, correct? So I think this is clear for you. Talking about giant cell tumor osteoclastoma, obviously, as I mentioned, this is more common in epiphysis region. Talking more like the most common bone that is affected, it is your lower end of femur. So I am writing lower femur, right? Lower end of femur and upper end of tibia, correct? Lower end of femur, upper end of tibia. That is, if I talk about the knee joint, right? Lower end of femur, upper end of tibia, also lower end of radius. Lower end radius. So these are your most common sites where you can find giant cell tumor or osteoclastoma. And regarding these bone tumors, we will discuss in a separate slide. Also regarding osteomyelitis, very important topic, we will discuss in a separate question, separate slide, right? So talking about the conclusion that your osteomyelitis, regarding this question, right? Osteomyelitis, osteosarcoma, both occurs in your metaphysis, right? And the bones involved are your knee joint and your proximal humerus. These are your common locations of osteosarcoma, right? Okay, talking about giant cell tumor or osteoclastoma, I mentioned that most common region of the bone is your epiphysis, and the most common site is your lower femur, upper tibia, that is if I talk about the knee joint, and your lower end of radius, right? So and we also saw different tumors as per location, like talking about diaphysis, we saw in diaphysis region we can find adamantinoma, osteofibrous dysplasia, osteosteoma, stress fracture, chronic osteomyelitis, fibrous dysplasia, round cell tumor, Langerhans cell histiocytosis, right? Talking about metaphysis, we saw fibrosarcoma, chondromyxoid fibroma, aneurysmal bone cyst, then simple bone cyst, fibrous dysplasia, pyogenic osteomyelitis, osteosarcoma, osteochondroma, non-ossifying fibroma, fibrous cortical defect. Talking about epiphysis, we found Trevor's disease, chondroblastoma, GCT, osteomyelitis, fungus and tuberculous origin, and aneurysmal bone cyst. So we saw different bone tumors and their location, also their most common sites, right? Okay.